Alrighty, so far I have gotten a couple different opinions regarding treatment. I have my original sleep doctor, which I'll talk about a little later, but in terms of surgical routes, I have talked to 3 surgeons, 2 orthodontists, and I'm going to see another orthodontist on Tuesday. And I wanted to share a little about how their opinions differ. So the first surgeon I saw was Dr. Koppelson from the Breathe Institute, and he recommended surgically expanded MSC. And I want to note one specific difference, though, is that on his protocol, he doesn't make any cuts along the cheek, Lefort 1 or Lefort 1 style cuts. And his reasoning for that is that he believes that if you kind of just cut along the mid-palatal suture, you can optimize the growth of the width of the nasal aperture by expanding out the mid-face, this way, rather than just expanding the floor of the nasal aperture. Because if you make complete Lefort 1 cuts and pull the 2 halves of the maxilla apart, you'll be expanding only the bottom of the nasal aperture rather than tilting it outward. That's kind of what he explained to me. And that's something that I've spoken with Dr. Vaughn in South Orange County and Dr. Wallin at the LA Center of Oral and Maxillofacial Surgeons. And they have both said that without these style of cuts, the expansion is very unpredictable or unstable, unreliable. And Dr. Wallin supports like a complete Lefort 1 osteotomy here, and Dr. Vaughn just cuts through a couple of layers. And I think the reasoning is that you have, apparently men especially, have a lot of, when it comes to palatal expansion, there's a lot of like skeletal resistance around here. So if you make that cut, it much more aids in the expansion of the maxilla. Which I'm a little bit torn between, because my goal isn't as much to expand the maxilla, but rather to expand the width of the nasal aperture. I know those are one and the same, but I'm trying to find out what the optimal route is. So that's where the 3 surgeons kind of have different opinions on the MSC. I would also like to say that Dr. Wallin from LA Comms, he is not even the biggest fan of MSE. It wasn't even part of his original treatment plan. He said that MSE doesn't really have enough evidence right now, and it doesn't exactly seem like the most stable procedure, but he did say that it's more or less safe, by saying that the only downfall would be just kind of a waste of time and money, which I'm willing to take that risk. When it comes to palatal expansion, one of the things that Dr. Wallin suggested was, I don't remember the name, but instead of having the MSE appliance slowly expand the maxilla, he recommended just a complete, I think they make diagonal cuts along the maxilla and expand it all at once, screw everything in together, and the moment you wake up you have an expanded maxilla just healing. I don't remember the name of that procedure, but that's something that he recommended, or he at least brought to my attention. That's something that Dr. Vaughn wasn't a fan of in my case. He said that Dr. Vaughn feels that if you do the surgically assisted MSE right, then it's much more stable. And I don't really know exactly what that means. So as for the actual device implantation, there's a couple different opinions that I've gotten. Dr. Koppelson thinks I should go straight for the surgical assist, but Dr. Wallin and Dr. Ting both said it wouldn't be a bad idea to start with just a implanted MSE without the surgical assist and see how it goes. And if I can't split my suture and I can't achieve sufficient expansion, then go for the surgical assist. So that's another option. Not only that, but there are different installation kind of protocols for the MSE. So for example, if I did go with Dr. Vaughn and Dr. Ting, then Dr. Ting would do a corticopuncture, which is, I don't know, they make tiny little perforations across your mid-palatal suture to help it expand. And Dr. Wallin doesn't do corticopuncture because he doesn't believe they help I'm guessing because the point of most resistance is not the mid-palatal suture, but other, parts of the skull. So that's another thing to consider. And as I start to listen to more of these doctors, I start to worry that there are other things I don't even know that I need to consider yet. And I also wanted to point out something very interesting. I think that, you get one opinion, and then you get your second opinion, and you bring up the things that happened in the first. So then you get your third opinion, you bring up the things that happened in your first and second opinion. And I think that it kind of makes it so each successive opinion you have seems more knowledgeable than the previous. But I realize that that's very unfair because the first opinion didn't have any controversial topic that you brought to their attention to really give their opinion on. And so I'm sure they have an opinion, as to why their route is better or worse compared to other routes, but you just didn't ask because you didn't know yet. Now, as for the last phase of the treatment, which is, more invasive, like double jaw surgeries and MMA surgeries and things like that, there's also, I think, some disagreements. With Dr. Koppelson, I didn't get enough detail, I think, but he just recommended double jaw MMA. When I talked to Dr. Wallin, he talked also about genioglottal advancement, which they'd cut the chin off, slide it forward, and it'll pull the tongue forward, which creates more space in the back of the airway and less obstruction from the back of the tongue. I don't think Dr. Koppelson mentioned anything like that. And Dr. Wallin talked also about different types of jaw surgeries. One would involve tooth extractions. And finally, Dr. Vaughn said that he thinks that the genioglottal advancement or genioplasty is not necessarily a bad idea, but he needs to observe me more to see if it's going to be a good fit. So I feel a little bit overwhelmed with what route to choose. I don't want to choose something irreversible. I don't want to make any mistakes. I do think overall, whoever I choose is going to be it's going to be good, but I can't help but worry if I'm making the right choice. I think also cost is another issue. Oh, by the way, check out this awesome computer simulation that LA Comms did. On the left is before, and on the right is what I'm going to look like after. Check out the change in my jaw. That is going to be crazy. I mean, when I saw that, it almost creeped me out.